I'm Dr. Saman Hewamana. Today I'm going to tell you a bit about a type of blood cancer called acute myeloid leukemia. It is an acute leukemia. As we have discussed previously, there are chronic leukemias and acute leukemias. Difference between acute leukemias and chronic leukemias are very significant. Acute leukemias come acutely, that means they develop over weeks or months. Chronic leukemias develop over a longer period. Also, acute leukemias should be treated immediately without waiting, as their complications can cause significant mortality. AML or acute myeloid leukemia is not one disease. There are different subtypes of acute myeloid leukemia depending on their genetic profile. Nowadays, we classify leukemias depending on their blueprint. We do certain genetic tests to know the subtype of acute leukemia. There is a type of acute myeloid leukemia depending on their genetic profile. We call good risk acute myeloid leukemia or good acute myeloid leukemia or good AML, which will need only chemotherapy and immunotherapy. They will not need a bone marrow transplant at the beginning. There is another type of acute myeloid leukemia we call high-risk acute myeloid leukemia that will be treated with chemotherapy. When the leukemia is not there, we do a bone marrow transplant to prevent the leukemia coming back. And also, when it comes to prognosis, or how likely that these leukemias can be cured or can put into remission, depend on genetic factors. There are broadly two different types of treatment for acute leukemias. Number one is chemotherapy or immunotherapy or specialized drugs to get a leukemia into remission. Not all acute myeloid leukemia will need bone marrow transplant. Who will need transplant will depend on their genetic profile or the subtype of acute myeloid leukemia. Certain subtypes will be treated only with chemotherapy. They have a very good prognosis or a cure rate depending on the genetic profile, only treated with chemotherapy or chemoimmunotherapy. Those types will require a bone marrow transplant if they relapse. That means if it come back later on after treatment. Those leukemias are treated only with chemotherapy. The second type is if they have a bad genetic profile or what we call high-risk myeloid leukemias, we combine chemotherapy and a bone marrow transplant. When you diagnose a patient with acute myeloid leukemia, you cannot do a bone marrow transplant. They will definitely need chemotherapy to get the leukemia into a remission. That means to make sure that leukemia is not visible in the patient's body. After those tests, if the leukemia is gone, we do bone marrow transplant to prevent the cancer coming back. In good risk acute myeloid leukemia, so good risk AML, bone marrow transplant is necessary only if the leukemia comes back. One thing to remember is, if you are treating only with chemotherapy, you need to give the right drugs and the right duration. When it comes to good risk acute myeloid leukemias, bone marrow transplants are not recommended. We treat only with chemotherapy or chemoimmunotherapy. Something to remember, this is very important. Those patients should get the right duration, quality drugs, and the right doses for the leukemia to go away. If you treat them with lower doses, shorter duration, and if the drugs are not of good quality, there is a very high probability the leukemia will come back. When you treat lower risk or good risk acute myeloid leukemia, it is important to give the right treatment. If you give the right treatment, there is a chance you will not need a bone marrow transplant and the leukemia will get cured. However, when it comes to high-risk acute myeloid leukemias, it is again important to give the right duration of treatment, the right doses and quality drugs. When the leukemia is gone after the initial treatment, it is important to do a bone marrow transplant to prevent the leukemia coming back.